relax the shoulder. Nice and easy on that one. How's that feeling right now?
Good. It feels like looser.
There it is.
Hey, yo.
Right side, and then you said knee, and then it's not pain, it's just popping.
Yeah.
Would you say that that's true? So the knee is not necessarily having some pain as much as it just pops when you do it?
I mean, it aches, but it's not like intense. Like right now, it's aching a little, and then so there's that little pop. Usually it's a louder pop, but yeah, that's kind of the process.
Yeah, and it's pretty regular that you can do that. Just just on demand, you can just like pop that knee.
Yeah.
Okay, and then you said that there is some discomfort from here back, but it goes into the groin as well.
Yeah, like hip. Yeah.
So more so here, or more so in the groin area?
I mean, when I feel it, like it runs like this.
Okay, so right into that area.
Yeah.
Okay, and then any discomfort back here?
This whole
That
area.
whole region on the right side? Okay. Any issues up in the neck, in the mid-back, anything going on here?
It feels tight, but I'm not in pain.
Okay. Well, just looking at you, now that we kind of look at the x-rays and we're also looking at your spine here, this area, you do have like that, like I told you, where it's kind of like a bit of a hyperkyphosis, which basically means it's curving too much, right? Now we talked about how your spine, how it kind of got the sway back posture, causing you to lean back, and as it leans back, this is where you're going to see it arches back to get you back into that center of gravity. Now looking at your spine as well, you will notice just basically from what we saw in the x-rays, it does kind of lean to that left side. And as it leans to the left side here, this is kind of where it compensates and goes back over to the center. And then like we talked about here, it goes out to that left side, comes back again. So we're going to see a lot of stress from here and then also in this area as well. So yeah, you definitely have some tension up on the upper left side here. And then a little bit in here, but this left side is definitely, you can see you got like some rocks for some shoulders here. Okay. And so you said that you're not always on the computer, or do you feel like it's pretty much mostly on the computer?
I mean, I'm either just sitting, talking to people, or I'm doing the documentation. So just computer.
Okay, gotcha. I want to scan you with our guy, little instrument here. We're going to go from the bottom all the way up. We're going to work our way all the way down, okay? Let's see what we got going on here. And so we're measuring for inflammation here. So when the joints get damaged, irritated, anytime you like roll your ankle or something like that, you're going to get swelling in that joint. And so when you have such a little tiny space for that nerve to come out of, but you get some swelling, right there is where you can see some of that pressure. Yeah, so right on that C3, C2, C4 area, we're going to be taking a look at what's going on there. There. Yeah, just a little bit of inflammation. No heart issues, lung issues, breathing issues, no asthma?
No.
Okay, good. So you get more heat on that left side than you are on the right side. It's interesting. Sometimes if there's more heat on one side than the other, that could mean that the left side is the problem. It also could mean that the right side is more of a chronic issue. So when that inflammation kind of occurs, that joint, when it's damaged, sometimes it's actually gets a little bit cooler, and that left side actually is the one that's more normal. But I'm going to push into the spine on the pelvis. As you feel any pain, tenderness, or any soreness, you let me know right away, okay?
Okay.
So first things first, I want to start with the foundation, which is your pelvis, and then we're going to work our way up on some of these other hot spots here, okay? So first things first, we have your L5. I'm going to go down into your sacrum here. So here's S1.
Yeah, it hurts.
Here's S2.
Yeah, it hurts.
And I'm going to go to the right side. Here's the upper joint.
Oh, that one hurts a lot.
Okay. And then the middle.
Oh, yep.
Okay, I think we're on the right spot here. Okay. And then the bottom one.
Yeah, it's uncomfortable.
Not as bad as the upper one though.
Yeah.
So that upper joint. 3, 2, and then 1. Any pain or soreness there?
Yeah, I mean,
3.
That one hurts.
2.
Yeah.
And then 1.
Yep. Just
All
used
of
to it,
them?
I guess. They all hurt about the same. Yeah.
All right. Here we got your C2. 3. Here's 4. 3, 4, 5. All of them?
Yeah, 5 bad.
5 is pretty sore.
Yeah.
Okay. What I want to do is first, I want to do your neck. Second, we're going to do your pelvis. And then we're going to do your mid-back. I want to decide if we're going to work on your L1 today. I don't want to do too much too soon, just because if I do all these different things and your body's like, wow, I got to start healing all these things now, it can be a lot for the body to take in.
Okay.
So sometimes less is more, just allowing your body to just heal and to recover. So we're going to see how it does, but we're going to start with these 3, and then we're going to take a look if we're going to work on that L1, okay?
Okay.
All right, so we're going to go ahead and start with that C5 here. You're gonna relax the arm up, bring it up over here, and then arm down. You like the beach? You like the mountains?
The mountains.
Okay, let's go to the mountains
Okay.
together. All right, 7, 6, we have 5 right there. And so we're gonna go ahead and bring it over from the right side. So we're gonna go ahead and grab onto that 5. I'm gonna stabilize you with this left hand. We're gonna give a little bit of a push going upwards, okay? Relaxing that shoulder, a little bit of push. Nice and easy on that one.
Good.
How you doing? You okay?
Yeah.
All right, you still feel your toes, right?
Yep.
Oh, we're making good progress then. This joint, like I said, it's gone back. We're gonna go and lift that thing back where it needs to be, okay?
Okay.
It's gonna be fun, don't worry.
Like, we'll try.
Yeah, we're gonna do our best. We're gonna do our best. There you go, right on over here. I'm gonna roll you quite a bit. I won't drop you, okay?
Okay.
I've been doing this for I don't know how many years, but haven't dropped anyone yet. Oh, that right there, relax the shoulder. Nice and easy on that one.
That felt good.
That was great. All right, so we're gonna do a little bit of walk here because I want to get movement in the pelvis. So go and stand, walk over to that wall for me. How's that feeling right now?
Good. It feels like looser.
Okay, good. We got one more lap and then we're gonna meet you at that table over here.
All right.
All right. So this joint, it's gone to the right, it's rotating to the right, but it's gone wedged on the left. So we're gonna try to bring that back down over here, okay? 1, 2, 3, we got your T4 right up over here. Let it go. Nice and easy on that. So let's talk about what we did here. So we did 3 things right now. The first was we did your neck. We got that C5, 2, 3, 4, 5. Again, your neck's very straight. You should have a curve going forward, but you've lost that curve. The good thing is you still got some good disc spaces, which means there's a lot more room for improvement there, okay? The second one was we did your right pelvis. That SI joint's really inflamed. Again, when that joint comes down, the tissues and the ligaments, that capsule is going to start to inflame up on top, and that's going to put some pressure here. Now when that pelvis drops down, it will cause some stress into the hip, it can cause stress into the knees, down into your feet. So as we lift that thing back up, and eventually we're going to get you that heel lift, right? We want to get movement first here, and then we're going to lift up that leg because that leg is super short on that left side, okay? After we get movement in the pelvis, then we'll start bringing your pelvis up in your legs here, okay? But that's where we're going to start, okay? I want to take a look at your L1 in just a second, but we will eventually need to work up in this area because as it goes to the left, it kinks back this way, all right? Then the last one that we did was your T4, that's this guy right here. Again, as it goes to the left, it kinks pretty far over here. So we're going to try to close that down to see if we can get you back closer to the center of gravity. Sound good?
Yep.
All right, let's have a scale and take a look here, L1 real quick. And then we'll wrap. Good. Yeah, you still got some heat reading on that side. I think we're going to adjust it. All right, let's do one more, okay?
All right.
All right. When you have stress in this L1, L2 region, these nerves, they travel down into your legs, right? And so oftentimes they'll go to your abdomen, your digestive system, but it will start shooting some pain sometimes in the legs as well. So both feet right over here. You're going to go face down. Let's do one more for you. Same thing. So it's gone 5. We have 4. We have 3. We have 2. And we have that L1. Again, this is where it kind of shifts over to that side. I want to go ahead and grab onto that with my thumbs here. And as I do that, I'm just going to get a little bit of a push right down in there. Okay, deep breath. Let it go. Whew. Nope, we're going to need to go ahead and do my thenars. 5, 4, 3, 2, and then one more. Let it go. Relax the belly. A little bit of a push just right there. One more time. Breathing in. And let it go. Relax your shoulders. There it is. Oof. Good job on that one. You did good.
Yay,
So proud of you. So basically, that's going to be it. Okay. So basically, we did those 4 things. Usually, I don't do as many. Sometimes I only do 1 adjustment. Some people, like yourself, might need to do all 4. Yeah. So you might feel some soreness with that. Okay. So when I do adjustments and things shift around, we did some work to the body. So now it needs to heal, and sometimes the healing process can be a little sore. 15 to 20 minutes, get an ice pack, put a paper towel around it, ice those areas if you need to. Okay. Walking is the best form of exercise. 15, 20, 30 minutes. Get some movement in your body. The more movement you have, the more it's going to start working on undoing the process of the stress that you've had. I'm so proud of you. Have fun.
Yay.
All right. So we'll see you soon.